Bismillahirrahmanirrahim. Today we will discuss the diseases of the stomach and inflammation and tumors of the stomach. They are most common. So inflammation of stomach, as you do, is called gastritis. And gastritis may be of different types, acute gastritis and chronic gastritis. So first we start with the acute gastritis, and this is a transient mucosal inflammatory process. And pathogenesis of acute gastritis, that includes the imbalance between defense forces and damaging forces of the mucosa of the stomach. So you must be aware of the various defensive mechanisms of the mucosa of the stomach. So the first defense mechanism is the mucus secretion by the mucosal cells, and then bicarbonate secretion into the mucus, mucosal blood flow, then apical surface membrane transport systems, and epithelial regenerative capacity, and elaboration of prostaglandins. So all these are defensive forces which normally protect the mucosa from irritants and acid secretion. So defensive forces, I repeat, surface mucus secretion, bicarbonate secretion into the mucus, mucosal blood flow, membrane transport systems, regenerative capacity of the epithelial cells, and elaboration of prostaglandins. And then damaging forces, so gastric acidity and peptic enzymes. So they are the major damaging forces, acid and enzymes. Then there are different injurious factors, like most common is H. pylori infection, Helicobacter pylori infection, non-steroidal anti-inflammatory drugs like aspirin, cigarette smoking, alcohol, gastric hyperacidity, and duodenal gastric reflux. So these are the damaging forces. Along with this, there is ischemia, and when there is hypotension, systemic hypotension, like in shock, so there is mucosal ischemia, and delayed gastric emptying. And this imbalance will lead to the development of acute gastritis, which may later on progress to peptic ulceration. So morphology of acute gastritis, there is edema in the lamina propria and vascular congestion. Surface epithelium is intact, so there are scattered neutrophils and presence of neutrophils within the epithelial cells that denotes the active inflammation, and there may be small erosions, and along with this, if there is minute hemorrhages, we label it as acute erosive hemorrhagic gastritis. So acute gastric ulceration, this may be seen in stress, especially extensive burns, trauma, hypovolemic shock, and these stress ulcers, they are called curling ulcers. And then there may be Cushing's ulcers. Cushing's ulcers are the ulcers which are seen in gastric mucosa in patients with raised intracranial pressure. If there is head injury or some tumor in the brain which may obstruct and lead to the raised intracranial pressure, these ulcers are called Cushing's ulcers. Pathogenesis of these stress ulcers, there is a role by non-steroidal anti-inflammatory drugs. So they inhibit the cyclooxygenase 1 and inhibit the production of prostaglandin E2 and I2. And in intracranial injury, there is direct vagal nuclei stimulation, which leads to hypersecretion of gastric acid. Along with this, there is hypoxia and reduced blood flow. So this is the microscopy of acute gastric erosions. So then is the chronic gastritis. So chronic gastritis is again of two types, that is H. pylori associated gastritis and autoimmune gastritis. We will discuss them separately, and in the end we will compare both of these types of chronic gastritis, that is H. pylori gastritis and autoimmune gastritis. So H. pylori gastritis, in 90% of the cases, it is due to H. pylori, and this microorganism is a curved rod which was discovered by Barry Marshall, and mode of transmission of this is by fecal-oral transmission. Pathogenesis of chronic gastritis by H. pylori. So there is enteral gastritis with hypersecretion of acid, and this bacteria has flagella, due to which they are motile in the mucus, and they also has an enzyme, that is urease, which hydrolyzes the urea into ammonia and raise the local pH. Then they have adhesins which adhere the bacteria with the mucosal cells. There may be secretion of toxins, that is cytotoxin associated gene A, and that leads to pangastritis. Sometimes there may be multifocal atrophic gastritis, and also there is cytokine secretion. So morphology of H. pylori chronic gastritis, there are intraepithelial neutrophils and neutrophils in the lamina propria. So intraepithelial neutrophils, they signifies active inflammation. In the GIT, whenever there are neutrophils in the epithelial cells, in the intraepithelial region, they indicate active disease. And there are plasma cells in the subepithelial region. And the mucosa may be atrophic due to loss of parietal and chief cells. Along with this, there may be intestinal metaplasia. And then there are lymphoid aggregates that are called mucosa-associated lymphoid tissue, and this lymphoid tissue may be transformed into a lymphoma, that is marked lymphoma. So these are the microscopic appearances. So these are subepithelial plasma cells and lymphocytes, and intraepithelial neutrophils. So this diagram shows the presence of H. pylori in the lumen of the enteral mucosal glands. This is a special stain, that is silver stain, for detection of H. pylori. So sometimes you may be asked, write the diseases associated with H. pylori infection. So these are the diseases associated with infection by H. pylori: chronic gastritis, peptic ulcer disease, gastric carcinoma, and gastric malt lymphoma. So how we diagnose a case of H. pylori gastritis, chronic gastritis? In the serum of these patients, there are antibodies against H. pylori. Then we may use urea breath test, and bacterial antigens can be detected in the stool, and then gastric biopsy, especially the enteral biopsy where most of these microorganisms reside. So histopathology can detect the H. pylori, and histopathology, that gastric biopsy, may be used for urea breath test and bacterial culture, and then bacterial DNA detection by polymerase chain reaction. So these are the diagnostic tests. Number one, serum antibodies against the H. pylori, urea breath test, fecal bacterial detection, gastric enteral biopsy, bacterial culture, bacterial DNA detection by PCR. So that is about the H. pylori chronic gastritis.